Hi everyone. Namaste and welcome to TimesHealth Plus. I am Dr. Sneha Rathi, a musculoskeletal physiotherapist and a certified yoga teacher from the Yoga Institute, Santa Cruz, Mumbai. I combine the techniques of physiotherapy and yoga to get the best results for my patients. So today, I have chosen to start by sitting on the ground, closer to the ground and with my legs folded. What are the joints that we are going to target today? Can you guess? You can put it in the comment box. Manya ji says knee. Anybody else would like to guess what joints are we targeting by sitting on the ground? Jagdeep ji says hips and knees. Vinod ji says knee joints. Manya ji says last session practice was very effective. Thank you. Neelu ji says hip joint. So yes, most of you are right. We are targeting the hip and the knee joint. With the advent of sofa, dining table, standing kitchen, Western commode, what are we missing on in our daily lives? We are missing on sitting on the ground with our hips and knees folded like this. Most of the meditative postures that we see in yoga are concerned with folding the legs and sitting on the ground for a stable base of support. So today we are going to see that how important this is to have this kind of mobility of the hip and the knee and how beneficial it can be by sitting on the ground and having this kind of mobility. So today we are going to discuss what are the functions of the hip and the knee, and we are going to discuss the asanas that are going to be effective to establish these functions. So first and foremost, can you tell me what are the functions of the hip and the knee? In our daily life, what does the hip and the knee function? Radha ji says mobility, Naveen ji says mobility, Charu ji says to walk. Absolutely. Manya ji says function to move. Dinesh ji says mobility and strength. Perfect. Vinod ji says movements. Charu ji says all standing activities. So absolutely correct. I think all answers are absolutely correct. The hip and the knee joints have basically two functions: weight-bearing functions and non-weight-bearing functions. The weight-bearing functions are basically something like standing, walking, maintaining the balance while standing, standing on one leg. So all these are the weight-bearing functions where we are putting weight on the joints. The non-weight bearing functions could be something like sitting or moving the ankle into space. If you want to move the ankle into space, you have to lift the hip and knee joint and move the ankle into space. So this kind of functioning our hip and knee joints do in our daily activities. So can you understand what kind of asanas do we need to target in order to actually bring back the function or train the function of the hip and the knee joint? So most of the asanas that we are going to learn today are going to be more of weight-bearing asanas because the function of the hip and knee joint is more in the form of weight-bearing. So today we are going to see a lot of standing asanas, but also the hip and knee, as right now I'm sitting down, it is also responsible for giving you postures like sitting on the ground or lying down, raising the leg up. So this kind of movements also are provided by the hip and the knee joint. So we are going to also see how to maintain the mobility of the hip and knee joint. And as somebody already said, Dinesh ji said, mobility and strength. Yes, both the functions are there of the hip and the knee joint. It gives you mobility. The hip gives you a lot of mobility, and strength as well is required for the hip. Why it is required? Because the hip is also responsible to be a stable base for your spine. So it is very important that the hip has a good amount of strength so that it can support your spine. It also supports the knees. So there should be enough movement at the hip so that the knees are not overloaded and they are also supported. Plus, there should be enough strength at the hip so that the knees are not, again, they are not put with a lot of pressure to work. And that's why it's very important that the strength of the hip and the knees is also targeted while doing any kind of asanas. So today we are going to not waste any more time. We are going to directly dive into some of the asanas. So let's start with the standing conditioning. So I would like all of you to stand on your mats. We will start with conditioning, that is Sthit Prarthanasana. So we are going to keep our legs together and look at one point in front of you. Now slowly join your hands in front of your chest. Keep your back erect, chin parallel to the ground. And slowly, as you are ready, you can close your eyes. If you have any balance issues, you can keep your eyes open as well. Or keep a little distance between your feet. Bring all your attention towards your breath and your body. Now slowly relax your hands and open your eyes. We are going to take a 1 foot distance and start with the warm up first because we want to make our body ready for the asanas that we are going to perform for the hip and the knee joint. So first and foremost, let's start with the neck. We are going to take our neck up and down. 1, 2, 3, 4, 5, 6, and 7. Now we're going to turn our head towards either side. So turn your head 1, 2, 3, 4, 5, 6, 7, and relax. Now we're going to drop our ear to the shoulder. So just take your head towards the side. 1, 2, 3, 4, 5, 6, 7. Now we're going to keep our hands on the shoulder and slowly rotate our shoulders. 1, 2, 3, 4, 5, 6, 7. Do it the other way around from back to front. 1, 2, 3, 4, 5, 6, 7. Perfect. Now slowly take your hands in front of you, shoulders at 90-degree, and make a fist and slowly rotate your wrist clockwise. 1, 2, 3, 4, 5, 6, 7. Now other way around. 1, 2, 3, 4, 5, 6, 7. Now interlock your hands in front of you and turn. 1, 2, 3, 4, 5, 6, 7. Relax. Now slowly take your hands at 90 degrees, elbows bent at 90 degrees, and lift your hip up. Try to touch the hand. 1, 2, 3, 4, 5, 6, 7. Perfect. Now bend your knee backwards and try to hold it. 1, 2, 3, 4, 5, 6, 7. Now do it on the other side. 1, 2, 3, 4, 5, 6, 7. Now rotate your ankle. 1, 2, 3, 4, 5, 6, 7. Do it for the other ankle. 1, 2, 3, 4, 5, 6, 7. So we are all ready for the asana. Shilpa ji says, all my joints make sound while exercising. That's okay. You can slowly continue to exercise. Gradually, the sound will reduce as your muscles become stronger. So make sure that you gradually make changes in your exercise or do exercises in such a way that there is strength improves in your muscles. That will reduce the sounds. All right. We are going to first start with Ek Padasana. If anybody has severe osteoarthritis, I would recommend you not to do that. And also, while performing the asanas, there are certain things which I would like to tell you. So let's look into that. So while doing Ekpadasana, we will just lift the leg up and slowly place it on the inner thigh with the help of our hand. Now, while doing this, if your hip is going like that is a wrong thing. It will strain your knees as well as your hip. So make sure that you are straight at the hip. And the other thing is that do not place your foot on the knee. It should be, if you're not able to take it up to the inner thigh, it's better to keep it below the knee. All right? So make sure that you don't keep it directly at the knee, as it will create a push on the knee, and that can actually strain the knee joint. So we are going to perform Ek Padasana. Let's do it. Stand on one leg and slowly take your other leg up. 1, 2, 3. You can hold the foot, or you can place your hands in Namaste position. 1, 2, 3, 4, 5, 6. And slowly relax and release. Same thing, we are going to do it on the other side. We're going to keep the foot on the inner thigh. You can hold the foot and then slowly join your hands. 1, 2, 3, 4, 5, 6. And slowly release and relax. You can hold this position for up to 30 seconds to 1 minute. That's fine. Okay, so we'll do it again. Lift your right leg up. Put it on the inner thigh. Join your hands. 1, 2, 3, 4, 5, 6. And relax and release. Do it on the other side. One, 2, 3, 4, 5, 6. And relax and release. We will repeat it once again. One, 2, 3, 4, 5, 6. Relax and release. And on the other side. One, 2, 3, 4, 5, 6. Relax and release. So this was Ek Padasana. Jagdeep ji says left wrist clicks and sticks somewhat only while doing clockwise rotations. No worries, you can continue to do clockwise rotations on a regular basis and see if that improves. Charuji, ma'am, I'm having pain in my heels while doing Vrikshasana. So probably you need to strengthen your hips and the knees so that they can support your heels. So you need to do some exercises for the hip and knee to become a little stronger so that they can take the weight from the heels. All right, so you can try doing that, some simple exercises for the hip and knee, some of which I'm going to tell it today. All right, let's go on to the next one, that is Utkatasana. Now, Utkatasana is a very good asana for the hips as well as the knee strength. It actually strengthens your gluteal muscles as well as your quadriceps muscles. Here, what we are going to do is we'll take a 1 foot distance. We are going to come up on our toes with our hands at the shoulder level. Slowly, we are going to bend, squat down completely. Stay there for 6 counts. And then slowly push ourselves up. Stay there again for 6 counts. And then relax and release. Again, if you are having osteoarthritis, you may not be able to do this. So it's recommended that you go only as much as possible. If that is also not possible, what you can do is you can support your back on the wall, take your feet in front and slowly glide down like that. Initially, till the time your hips and knees become strong enough. So let's start with Utkatasana. Slowly come up on your toes. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there with normal breathing. 1, 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Stay there. 1, 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Your very important thing is that you're not going to put your knees downwards. Your knees should not face downwards when you are squatting. Whenever you are squatting, your knees should face forward, because if the knees are facing downward, you might get some pain in the knee joints. So it's very important that you train your knees to face forward whenever you are squatting. So let's do it again. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 1, 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Stay there. 1, 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Whenever you are holding the position, make sure that you're breathing normally over there. We will repeat this once again, last time. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. All right, relax. These are weight bearing asanas, so it's going to give a lot of weight on your feet, knees, hips. So it is very important that these muscles are strong enough to take the weight. If they are not that strong, you might develop some pain in the feet or in the heels or in the knees. Okay, so it's very important that you first work out on a preliminary basis with some basic exercises so that they become strong enough, and then start doing these weight bearing asanas. That will give you less of pain and more of strength in the joints. All right, so let's go on to the next asana, that is known as Veerbhadrasana 1. So here what we are going to do is, we are going to take a distance about 3.5 to 4 feet. We are going to turn one foot outside. Slowly, we are going to turn our body towards that leg and bend the knee. Take our hands up from the front and stay in that position. 1, 2, 3, 4, 5, 6. Take our hands down and slowly come back to the starting position. We're going to do the same thing on the other side. Turn the foot outside. Turn your pelvis towards that leg and slowly bend your knee. Take your hands up. Maintain the position. 1, 2, 3, 4, 5, 6. And slowly come back to the starting position. We will do this. All right, so it's very important that the turning of the pelvis is done properly. Okay, so first you turn the foot outside. Keep the other foot about 45 degrees turned inside towards you. Okay, and now slowly turn your body towards the leg. Bend your knee. Take your hands up to elongate your spine and stay there. 1, 2, 3, 4, 5, 6. Release your hands and slowly come back to the starting position. Let's repeat it on the other side. Turn your body and bend your knee. Take your hands up. 1, 2, 3, 4, 5, 6. Slowly come back and relax. So over here, it's very important that when you're going down like this, one thing is that you should have enough distance between your feet. Okay, your knee should not be crossing your ankle. So stay within the ankle range of motion. Another thing is that don't lean forward. All right, otherwise you're shifting the entire weight and the knee might hurt. So make sure that your body is straight. Your pelvis is on your hips. All right, so we go like that and then raise our hands so that we can elongate our spine and make sure that our pelvis is on our hips. So let's do this again. Once more. Turn it outside, turn your foot outside. Slowly turn your body and bend your knee. Take your hands up. Inhale. 1, 2, 3. Normal breathing. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. We're going to do it on the other side. Turn your body towards this side. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Okay, so this was Veerbhadrasana 1. Now we are going to do Veerbhadrasana 2, wherein we are going to go sideways. So our hip can move in this direction as well as it can move in this sideways direction. So now we are going to train the hip to move in the sideways direction. So again, take a distance about 3.5 to 4 feet. Turn your foot outside. Take your hands at the shoulder level. Inhale and go down. Stay there. Look at your right hand. And come back and relax. We'll do it on the other side. Take your hands to the shoulder level. Bend your knee. Look at your left hand. Stay there. Come back to the starting position and relax. Your very important thing is that when you're going towards this side, you're not leaning towards this side as well. Okay, again, your pelvis should be on top of your hips. So you need to be straight from your pelvis up. All right, you cannot bend like that. So if you are by chance bending like that, slowly and steadily try to bring your pelvis again back on your hip. Just train this movement. Okay, just train this movement and get your pelvis back on your hip. So this is going to strengthen a lot of muscles of the hip. So let's do it again and experience this. Turn your right foot outside. Inhale, take your hands up. 1, 2, 3. Exhale. 1, 2, 3. Look at your right hand. Stay there. 1, 2, 3, 4, 5, 6. Inhale and come back. 1, 2, 3. Exhale. 1, 2, 3. We repeat it on the other side. Turn your left foot outside. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Let's repeat this again. Turn your right foot outside. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. So you should feel something happening on the backside of your thigh as well as your glute muscles, as well as your front of the thigh. You should feel that the muscles are getting activated over there. Let's turn the left foot outside. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Okay, so this was Veerbhadrasana 2. This is going to help in opening of the hip in the side direction, as well as train the hip and knee to be working in this direction as well. All right, so most of the times we are walking in the front direction, okay, but this side direction also needs to be trained, because it is very much required whenever you are standing on one leg, or you are walking, or you're doing some activity sideways, okay, or you are lifting something. It's very important that these side muscles are also trained. So Veerbhadrasana 2 is for that. Now next, let's go on to Malasana. Malasana is a little challenging pose. So many of the people with hip and knee restrictions or ankle restrictions might not be able to do it. So it's better to avoid attempting that. But those of you who can do it, please try to do it on a regular basis. It's a very effective posture for opening of the hips. So let's take a 3.5 foot distance between our feet. Turn the feet outside, 45 degrees. Now slowly bend from your hip and join your hands in front of you and push with the help of your elbows on the inner thighs. So push your hips outside with the help of your elbows. Stay there for 6 counts. And slowly relax your hips and come back to the starting position. This is going to give you a lot of stretch in the pelvic area. It's a very good asana so that to improve the pelvic circulation. So it should be attempted on a regular basis. But it's very important that you see to it that whenever you're going in Malasana, you're not bending forward like that. If you are bending forward like that, it's good to hold something and then try to straighten yourself up. Okay, so gradually just hold something and try to straighten yourself up. Do not be into this position, forward flex position, while performing Malasana. So let's do it again. 3.5 foot distance. Turn your foot 45 degrees. Inhale, exhaling, bend down, 1, 2, 3. Join your hands and push your knees outwards. Stay there. 1, 2, 3, 4, 5, 6. Relax your hands and slowly come back to the starting position. Okay? So it might be Shibaji says lower back is paining during the last asana. Is it Veerbhadrasana or is it Malasana? Can you just mention that? Till then, we will again repeat this asana once again last time. Stay with 3.5 foot distance. Yeah. Now slowly bend down. 1, 2, 3. Join your hands and push your knees outside. Stay there. 1, 2, 3, 4, 5, 6. Slowly come back to the starting position. If you're unable to get up directly from the ground like that, you can always bend forward, hold your toes, get up like that, and come back to the starting position. That is also fine. Okay, so you need a good amount of strength in the inner thighs. So that's why it's very important that you make sure that you bend forward and then come up. If at all, it's not possible to get up straight. Veerbhadrasana. Okay, Shibaji. So in Veerbhadrasana, when you're doing this, in case if you are overstraining your back to keep it straight, then also it can hurt. Or if you are leaning towards that leg to, attempt the asana, then also it can hurt. So what I would like to advise you is to observe your position, what position is your back into, and slowly correct it. If it is too much into extension and you're trying to keep it excessively straight, then try to relax it a bit. If it is bent towards that side, then slowly, gradually, not in one day, but gradually try to bring it back onto the hips. All right, so try to attempt that. That will take away your lower back pain. Okay, so that's about the standing asanas. So these were the standing weight bearing asanas that you can do on a regular basis. There are many more asanas which can be attempted, but today I'm going to only take these few asanas. Now let's attempt some of the sitting asanas, because that is also very important for hip opening. So let's go into sitting position. We're going to first do Bhadrasana or butterfly stretch, which I think most of you must be knowing. Okay, it's a very good hip opening asana. So those who have tight adductors or inner thighs can actually have a good stretch with this kind of pose. So over here, we first sit into Dandasana and slowly bend your feet, bring your feet together, and get it close towards your pelvis. Try to bring your knees down towards the ground and back is straight as possible. Maintain this position for 6 seconds. 1, 2, 3, 4, 5, 6. And slowly release this posture. You can also maintain this position for about 30 seconds to 1 minute. We are doing it dynamically, so we are just maintaining it for 6 seconds. Let's do it again. From the Dandasana position, bend your knees as much as possible. Try to use your muscles while bending the knees. Okay, if you directly use your hands, you're not using your muscles. So while bending your knees, try to use your muscles as much as possible, and then use your hands to get it closer to your body. Hold your toes. Keep your back straight, knees down. Stay there. 1, 2, 3, 4, 5, 6. And slowly release. Okay, you can also add up a forward bending into this. For example, you bend your knees, get it closer to your body, and slowly try to bend forward as much as possible. Come back to the starting position. This is going to add on to the stretch that is happening at the inner thighs. And slowly release your posture. All right, so this was Bhadrasana. Next, let's go on to Ashvasanchalanasana. Here, we are going to keep our hands, go into quadruped position. We're going to keep one foot forward, keep our hands beside the foot, and slowly lean into the foot like that. Look up, stay in that position. 1, 2, 3, 4, 5, 6. Relax and release. Now do it on the other side. Keep your foot forward. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Now over here, it's very important that whenever you're keeping the leg forward like that, okay, you have a good firm grip of this foot on the ground. And then you slowly try to manipulate your hip, use this hip to just push forward like that. You will feel some stretch on the thigh over here. Okay, so do that and stay there. 1, 2, 3, 4, 5, 6. and slowly relax and release. Okay, do it on the other side. Inhale, 1, 2, 3. Stay there, 2, 3, 4, 5, 6. Exhale, 1, 2, 3. Okay, so this was Ashwasanchalanasana. Let's go on to another hip opening pose, that is Kapotasana or pigeon pose. Okay, so in Kapotasana, what we are going to do is, we are going to keep one leg into external rotation like that. Keep the other leg behind, stretched behind, and slowly weight bear on our hands and try to push ourselves up. Stay there. 1, 2, 3, 4, 5, 6. And relax and release. This is again a slightly challenging pose. It's very important that you do not strain your knee while you are performing this pose. Okay, so make sure that you're keeping your hip open as much as you can. Just try to open the other leg up and slowly go into stretching this hip downwards towards the ground as much as you can. Push yourself up from the upper body and stay in that position. 1, 2, 3, 4, 5, 6. Relax and release. Okay, so this was Kapotasana. You have to do it very cautiously because it's important that you focus on hip opening and not straining your knee while you are performing this asana. So you have to make sure that the force that you are pushing is coming from the hip. So you're pushing your hip down and not exerting your knee over here. Okay, so stay there. 1, 2, 3, 4, 5, 6. And relax and release. Repeat it on the other side. Go downwards. So over here, the force is concentrated over here and you feel the stretch out here. 1, 2, 3, 4, 5, 6. Relax and release. So this was Kapotasana. Next, for the knees. Okay, if you have normal knees and don't have any kind of condition like ligament injury or knee osteoarthritis, you can always plan to sit in Vajrasana. It's a very good position to give complete mobility to the knee, as well as the hip is bent to 90 degrees. So it's a very good position, not just for digestion, but for the mobility of the knee as well as the hip. So to maintain the mobility, it's a very good asana. So you can always sit into Vajrasana position. It's also going to stretch your foot muscles. So that is also a good thing to do because of all the tension that is built throughout the day while walking. So it's a good way to actually relax the front shin muscles and also give good mobility to the knee. So Vajrasana is the next position. You can stay in that position with normal breathing. You can close your eyes and just stay in that position. Okay, and relax and release. Come back into Dandasana. One simple exercise for the knee in long sitting position I would like to tell you is just to contract the kneecap and try to pull it towards you. So you're just trying to push the knee downwards towards the ground and hold it. It's called static quadriceps exercise. So you're just activating the quadriceps muscle. Okay, so what you can do is you can just push downwards towards the ground, try to pull the kneecap towards you, hold it for 5 counts, 1, 2, 3, 4, 5, and relax. Again, contract 1, 2, 3, 4, 5, and relax. Contract 1, 2, 3, 4, 5, and relax. So this is a very good exercise for the knee. Okay, so whenever you have a knee pain, you can always activate these muscles. That actually helps in reducing the knee pain. It's a very commonly given exercise, so you can always practice this. You can practice it in lying down position also if you're not comfortable in long sitting position. Next, we are going to go for two asanas, which are very good, again, for the hip and the knee in the lying down position. So we are going to just turn on our side and lie down. So first asana is going to cause hip extension or bending the hip backwards. That is called as Setu Bandhasana. So you keep your feet shoulder width apart. And slowly raise your hips up by pushing on your feet as much as you can. Stay there. 1, 2, 3, 4, 5, 6. And slowly come back down and relax and release. So for those who cannot perform standing weight bearing asanas, starting with weight bearing and lying down position is a good way to actually start strengthening your hips and knees. So let's do it again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Now, it's very important while performing this asana, you're not pushing too much from your back, but you're making sure that the hips are engaged properly. And there is opening at this point of the hip. Okay, so try to focus over here and try to open that as much as possible. We will repeat it again. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. Last time. Inhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Exhale. 1, 2, 3. So this was Setu Bandhasana. Next, what you can do is Pavan Muktasana. So that also causes a good amount of knee bending. So those of you who have any problem related to knee bending can always attempt Pavan Muktasana. So you can do it one leg at a time or both the legs together as well. So let's do it one leg at a time once and then both legs together. Inhale. Exhaling. Bend your knee. 1, 2, 3. And bring it as close to your body as possible. Point your ankle down. Stay there. 2, 3, 4, 5, 6. Slowly inhale. 1, 2, 3. So this is like complete bending of the hip and knee, okay, which is again very good. So those who cannot perform Vajrasana can actually start doing Pavan Muktasana first. Inhale, other leg. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Now let's do it both the legs together. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Let's repeat this once again. Inhale. 1, 2, 3. Exhale. 1, 2, 3. Stay there. 2, 3, 4, 5, 6. Inhale. 1, 2, 3. Exhale. 1, 2, 3. So this is another asana that will be really beneficial for creating mobility at the hip and knee. Besides this, you can always do straight leg raises like that. This is also a very good exercise to actually improve the strength of the hip. But most of the times what people do is they tend to strain their back while doing this. So it's like this, a lot of movement at the back. So make sure that you are keeping your back stable and then raising the leg up as much as possible. Okay, so the back should be stable and raise the leg only as much as possible. Gradually, you will notice that the strength is improving and you are able to raise it much beyond you could actually do it. All right, now let's do one breathing exercise to relax ourselves. So just bend your knees, keep your knees together, feet apart. Keep one hand on the abdomen. We will do 5 rounds of this. Inhale, 1, 2, 3. Exhale, 1, 2, 3. When you're inhaling, the abdomen should rise, and when you're exhaling, the abdomen should fall down. Inhale, 1, 2, 3. Exhale, 1, 2, 3. 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 Normal breathing. Slowly turn on your side and lie down on your side with your hand under your head. You can keep your knees and hips bent slightly, or you can keep it straight as you are comfortable. If you are unable to maintain the straight position, it's okay to bend your knees and hips slightly. You can keep your eyes closed and breathe normally. Now slowly take the support of your hands and get up. And sit with your eyes closed. Breathe normal. Slowly rub your palms. Keep it on your eyes. Cup your eyes. And slowly open your eyes. So today we did some of the asanas which are going to strengthen the hip and knee as well as give good mobility to the hip and knee. So gradually, don't try to target it in one day, but gradually you can try to improve the mobility of the hip and knee by doing this asanas with making sure that you are not causing any discomfort to your body, but the asanas are very comfortable while performing them. All right, so if there are any questions, please check whether it is 3 to 3.5 wide or 2 to 2.5 for Malasan, GCG. So you can, if you feel that 3 to 3.5 is too wide and it's causing a lot of stretch on the inner thighs, you can always begin with 2 to 2.5 foot wide. That's absolutely okay. Naveen ji, please tell some asanas for sciatic pain. Okay, so sciatic pain can actually happen due to compression in the lumbar spine, in the lower lumbar spine. If there is a compression due to disc prolapse or due to lumbar spondylosis, it could be any of the reasons. I would recommend that you consult a physiotherapist for the same and get yourself assessed, and that will actually help in improving the sciatica. that is a better way to approach sciatica than directly going on for some asanas. But some of the asanas that can be beneficial, if at all I have to tell you, then there are something like the Shalabhasan can help, something like the Kapotasana can help. So you can always do that. Jagdeep ji says some mobility is restricted due to friction of moving joints with efficient high friction mats. Yes, there can be some high friction mats can actually cause a lot of restriction. So you can use good mats which have low friction, and that is better. Sagarji says Malasan is a bit difficult. I couldn't go down completely. That's absolutely okay. You go down till the level you can easily go, and then gradually try to push yourself little by little on an everyday basis. So assess yourself first, how much you are able to do on day one, and then gradually try to push yourself little by little. There may be some restrictions in the ankle or some restrictions at the hip and knee. You need to actually check, okay, where am I feeling the restriction, and try to push yourself very gradually and by concentrating on your comfort. Vinodji, Sumitji says, thanks for a good joint mobility session. Thank you so much. Will these asanas be shared for regular practice? Yes, the recording of this video will be available on YouTube. So now I have a challenge for you. You're supposed to perform Malasan for 1 minute and click a picture of it and upload it on Instagram and tag TimesHealth Plus. Also, make sure you do follow TimesHealth Plus on Instagram as well as YouTube, and be updated with the posts on it and the tips and recommendations that they give you. All right, so that was it for today. Thank you so much for joining, and I hope to see you next time with some new asanas and some new techniques and technicalities of the asanas. And I hope to see you next time. Join again. Till then, stay present, move gently, and make sure that you take care of yourself and go gradual with the asanas. Thank you and namaste.